Good morning. Today we'll discuss the general anatomy of the lymphatic system. At the end of the lecture, the students should be able to discuss in detail the parts and the function of the lymphatic system and discuss its clinical aspect. Now, the lymphatic system is essentially a drainage system that is accessory to the venous system, and most of the tissue fluid absorbed at the arterial end of the capillaries is absorbed back into the blood by the venous end of the capillaries and the postcapillary venules. The rest of the tissue fluid, that is about 10 to 20%, is absorbed by the lymphatics, which begin blindly in the tissue spaces. It is important to know that the larger particles, that is the protein and the particulate matter, can be removed from the tissue fluid only by the lymphatics. Therefore, the lymphatic system may be regarded as drainage system of the coarse type and venous system as the drainage of the fine type. Now, there are certain parts of the lymphatic system, that is the lympho-reticular organs. However, they are chiefly involved in phagocytosis, raising an immune response and contributing to the population of the blood and the lymph. Now, what is lymph? It is the tissue fluid flowing in the lymphatics, and it is passing through filters, that is the lymph node, placed in the course of the lymphatics, finally draining into the venous blood over here. Lymph from most of the tissue is clear and colorless, but from the small intestine it is milky white due to absorption of fat. The intestinal milky lymph is called the chyle and the lymph vessels called the lacteals. Now, the components of the lymphatic system, there are four components: the lymph vessels, central lymphoid organs, the peripheral lymphoid organs, and the circulating lymphocytes. Firstly, the lymph vessels. The lymph capillaries are beginning blindly in the tissue spaces and forms intricate networks. Their caliber is greater and less regular than that of the blood capillaries, and their endothelial wall is permeable to substances of much greater molecule size. These are one of the reasons why the cancer cells and the infection can spread through the lymph vessels easily. The lymph capillaries are absent from the cellular structures like the brain, spinal cord, the splenic pulp, and the bone marrow. The difference between the lymph capillaries and the blood capillaries, they are colorless, difficult to observe. This is reddish, easy to observe. It is blind, closed at the tip, joined to arterioles at one end and the venules to another end. The lymph capillaries are wider than the blood capillaries. These are narrower than the lymph capillaries. The wall consists of thin endothelium and poorly developed basement membrane, therefore facilitating the permeation of cancer cells. Whereas the blood capillaries consist of normal endothelium and basement membrane. Contains the colorless lymph, contains the red blood. They are relatively low pressure, relatively high pressure, absorbing tissue fluid from the intercellular spaces and adding tissue fluid to the intercellular spaces, the function of the blood capillaries. Now, the lymph capillaries, as seen over here, join to form the lymphatics, and they can be superficial and deep lymphatics. The superficial lymphatics are accompanying the veins, whereas the deep lymphatics are accompanying the arteries. The lymph passes through filters or barriers in the regional lymph nodes, which are trapping the particulate matter. The filtered lymph passes through larger lymphatics and eventually collects into two major trunks, that is the thoracic duct and the right lymphatic duct, which pour their lymph into the brachiocephalic veins. Now, this is your thoracic duct over here, right? The thoracic duct is draining both the lower limb, the abdomen, the left half of the thorax, head and neck, and left upper limb. Whereas the right lymphatic duct is draining the right half of the thorax, head and neck, and the right upper limb. Now, the thoracic duct, this is the thoracic duct, it's draining both the lower limbs, the abdomen, left half of thorax, head and neck, and the upper left and the left upper limb. These lymphatics are anastomosing freely with their neighbors of the same side as well as the opposite side, thereby increasing the facilitating the movement of cancer cells and infection because they are anastomosing freely with the neighbor of same side. Larger lymphatics are supplied with their vasa vasorum and are accompanied by plexus of fine blood vessels, which in form of red streaks are seen in lymphangitis or infection of the lymph vessels. Now, the second component is the central lymphoid tissue, basically contains two important elements, the bone marrow and the thymus. Now, all the pluripotent lymphoid stem cells are produced initially by the bone marrow, except during early fetal life when they are produced by liver and the spleen. These stem cells undergo differentiation at the central lymphoid organ so that the lymphocytes become competent defensive elements of the immune system. Bone marrow helps differentiation of the committed B lymphocytes, which are capable of synthesizing antibodies after getting transformed into plasma cells. The B cells in birds are differentiated in the wall of a bursa of fabricis, a hindgut derivative from where it is deriving its name. The thymus helps differentiation of immunologically competent but uncommitted T lymphocytes, that is about 10% of thymic population, which are long-lived. They join the circulating pool of lymphocytes and populate the thymus-dependent areas of lymph nodes and other peripheral lymphoid organs. Now, the T cells, being uncommitted, can react to a wide range of foreign antigenic stimuli, unlike the B cells, which are committed to just forming the antibodies. They respond, that is, the T cells respond by cytotoxic cell killing, that is, killing of virus infected cells, the neoplastic cells, fungi, tissue graft, etc., by arming the macrophages and by triggering the large mononuclear cells or the killer cells and the helper activity of the B lymphocytes. The third component is the peripheral lymphoid organ. The peripheral lymphoid organ comprises of the lymph nodes, the spleen, the epithelio-lymphoid tissue, that are the lymph nodes developed in the alimentary tract and the respiratory tract. Any part of this may become overactive on appropriate stimulation. Now, the progenies of the B and the T lymphocytes reach these organs where the cells may proliferate and mature into competent cells. The mature lymphocytes join the circulating pool of the lymphocytes. So, what is this circulating pool of lymphocytes? The pool contains mature progenies of B and T lymphocytes, which may be called upon during antigenic emergencies. So this is what a lymphatic follicle looks like, or a nodule. We have a collection of lymphocytes occurring at many places in the body, and they all have a basic pattern. Now, this basic pattern of the follicle is a spherical collection of lymphocytes with a relatively pale center known as the germinal center, where the lymphocytes are loosely packed. Whereas the central cells are larger in size, stain less deep, and divide more rapidly than the peripheral cells. The lymph nodes The lymph nodes are small nodules of lymphoid tissue found in the course of the smaller lymphatics. The lymph passes through one or more lymph nodes before reaching the larger lymph trunk. The nodes are oval or reniform in shape. They can range from 1 to 25 mm in length, light brown, black, or creamy white in color. Usually they are occurring in groups, like we have the cervical lymph nodes, the axillary lymph nodes, the inguinal group of lymph nodes, the mesenteric lymph nodes, mediastinal, etc. But at times there could be only a solitary lymph node. The superficial nodes are arranged along the veins, whereas the deep nodes along the arteries. The cervical lymph nodes form a ring at the junction of the head and neck and vertical chains in the neck. They are draining the whole of the head and neck. On right side, the lymph vessels are draining into the right lymphatic duct, whereas on the left side they are draining into the thoracic duct. The lymph vessels of the abdominal wall, above a line passing horizontally through the umbilicus, drain into the respective sides of the axillary lymph nodes, whereas the lymph vessels below the line drain into the inguinal group of lymph nodes. This line is called the watershed line. So if you see a gross structure of the lymph node, right, it has a slight depression on one side. This is called the hilum of the node. The artery is entering the node from this area, and the vein, when the efferent lymphatic comes out, this is at the hilum. You can see the efferent lymphatic vessels over here. The afferent lymphatics enter the node at different parts of its periphery. Right. So structurally, the lymph node is made up of the following parts. It has a fibrous and a reticular framework, right? The lymph node is covered by a capsule. You can see the afferents are coming from the peripheral area, whereas the efferents are going out from the hilum. The deep surface of the capsule, a number of trabeculae extending radially into the interior of the node, where they are continuous with the fine reticulum which is supporting the framework for the lymphoid tissue. Here, the lymphatic channels, what are they? Right. So you saw that the afferents are coming from the periphery. Okay. Now these afferents are coming in from the periphery and draining into this part called the subcapsular sinus, which is shown in greater magnification in the next picture here. This is your subcapsular sinus beneath the capsule, right? And is surrounding the node except at the hilum. So many afferent lymphatics of the node open into the subcapsular sinus. The lymph is filtered through the reticular fibers and leaves the node by one efferent lymphatic vessel, as you can see over here. So this is the capsule. You can make out these are the lymphatic follicles. In between them, there's a slight area over here. This is called the subcapsular sinus. The subcapsular sinus is receiving the lymph from the efferent channels. There is only one efferent channel which is coming out from the hilum. Now, grossly, after this capsule, we have the outer cortex and an inner medulla here. So, this is the outer part of the lymph node situated beneath the subcapsular sinus, being absent at the hilum. It is made up of lymphatic follicles and traversed by the fibrous trabeculae. Trabeculae are nothing but invaginations of this capsule inside the substance of the lymph node. The cortex, as you can see, is far more densely cellular than the medulla. Now it is divided into zones. Zone 1 containing the loosely packed lymphocytes, macrophage, and occasionally plasma cells in the periphery of the follicle, right over here, extending into the medullary cords, cyomedullary cords, that are the extensions of these nodes inside the medulla. Zone 2 containing more densely packed small lymphocytes, deep to zone 1, limited to the cortical areas and the paracortical areas. Okay? This is your paracortex or the deep cortex. Zone 3 includes the germinal center containing large lymphocytes and macrophages. The maturing lymphocytes pass from zone 3, this is the least mature, in the germinal center, then zone 2, and then the zone 3, and to the lymph sinus over here, the subcapsular sinus. Right, you can see this. Okay, here, this is the subcapsular sinus, outermost. Now, according to the distribution of the B and the T lymphocytes, the cortex is divided into an outer part which contains the immature B lymphocytes, inner part between the germinal center and the medulla called the paracortex containing the T lymphocytes here. The mature B lymphocytes or plasma cells are found in the medulla. The paracortex basically is a thymus dependent zone that contains your T lymphocytes. This is the medulla, central part of the lymph node containing loosely packed lymphocytes, plasma cells, and the macrophages. The blood channels. The artery entering at the hilum divides into straight branches called in the trabeculae, running in the trabeculae. The cortex, in the cortex, the arteries further divide to form arcade of arterioles and capillaries with the anastomosing loops. Right, so the capillaries will give rise to the veins and the venules which run back at the hilum. The capillaries are more profuse around the follicles, and the post-capillary venules are more abundant in the paracortical zones of the lymphatic migration. What is a hemal node? They are small lymphatic bodies resembling lymph nodes in their structure, which are found in the course of the blood vessels. The afferent and the efferent lymphatics are absent, and their sinuses are filled with blood rather than lymph. They are found in lower animals. Hemal nodes may be considered as an intermediate stage between a lymph node and a spleen. In man, the spleen is the large hemal node. Now, the mononuclear phagocyte system or the macrophage system, also called reticuloendothelial system, this system is closely related to the lymphatic system because the two are dependent structurally and functionally. How? The macrophage system is basically made up of highly phagocytic cells distributed widely in the body. These cells are include the macrophage of connective tissue, reticular tissue, and the lungs, the monocyte of the blood, Kupffer cells of liver, meningocytes of meninges, microglial cells of nervous tissue, foreign body giant cells, the endothelial cells, fibroblasts, and most leukocytes are not included in this system because of their low power of phagocytosis. Right, you can see the macrophage over here. It's the electron microscopic view of the macrophage. Function: it is forming a first line defense of the body against microorganisms. Because of its amoeboid and the phagocytic properties of the cell, the macrophages of the lymphoid tissue are now considered to be intimately concerned with the mounting specific immune responses by the neighboring cells. Many of the prominent sites of this system are also important sites of hemopoiesis.